Hello friends, today we'll discuss about the remaining portion from spinal cord injury chapter. Okay, so today we'll discuss about the treatment part. Treatment of spinal cord injury. Okay, so first we'll see emergency care. Emergency care. Okay, so in emergency care, actually it starts from the location of the injury itself. Okay, starts from the location of injury itself, and the proper technique used to transport the patients, handle the patients and transport the patient influences the outcome of prognosis. Okay, so first one spinal backboard is used on the location area to stabilize the area of the injured area of the patient. Okay, and once the patient reaches to the hospital, then the specialist, they take care of their patient's cardiorespiratory, hemodynamics, stability. Okay, then after that patients take care the patients, then catheterization is done to evacuate the bladder, and steroid methylprednisolone is given. Almost it starts 4 to 8 hours after injury to 24 to 48 hours. Okay, then second is the stabilization, fracture stabilization. Okay, so again it is two types. One is conservative, and the other is surgical. In conservative, basically the fracture reduction and stabilization is done with tongs, different type of tongue. It is called a cervical tongue or crutchfield traction. There are different varieties of cervical tongues are there. Okay, one of them is crutchfield. Okay, in crutchfield they give traction. It is a traction device actually. Okay, so it is attached to the outer table of the skull, through which one rope is suspended and weight is attached to the other end of this rope. Okay, through this crutchfield device traction is given, and the weight of the crutchfield traction is decided by the specialist. Okay, then after that it is followed by halo device, traction with halo device. Okay, so a halo device is a halo rings attached to the skull, which is attached to the body jacket. So three parts are there. Basically the halo ring attached to the skull, then the second is the body vest, body jacket, and the suspended rods are there, connected with suspended rods. Okay, and so after traction, the treatment maintenance is followed with the halo device. Okay, so in surgical treatment, anterior and posterior arthrodesis of the spine is done. Okay, with rods and screw. So the durations of the traction, durations and the weight used for the traction is decided by the specialist. Okay, specialist, basically orthopedicians and neurologist specialist. Okay, which is followed by the immobilization. So basically the cervical traction is followed by the immobilization with SOMI brace, sternocipitomandibular immobilizer, or it is called as Philadelphia cervical collar. Cervical collar. And the durations of the use of Philadelphia is also decided by the specialist. Okay. Then the thoracic area or injury to the thoracic area and lumbar area is immobilized with TLSO, thoracolumbo-sacral orthosis, or body jacket. Okay. Then we'll discuss about the physiotherapy management, PT management. Okay. So first, in PT management, respiratory care is done. So respiratory care. So in respiratory care, basically the breathing technique is taught to the patients. Breathing technique, that is deep breathing exercise. Deep breathing exercise. Okay, then air shift maneuver is taught to the patient. Maneuver. Okay, in deep breathing exercise, basically diaphragmatic breathing is taught to the patient. Then in air shift maneuver, what is taught to the patient? Patient has to take deep breath. Okay, then after that, patient has to close the glottis and relax the diaphragm, which allow air move from the lower part of the lungs to the upper part and increases the thoracic expansion. Okay, then the other technique is glossopharyngeal breathing. Glossopharyngeal breathing. Okay, then the other technique is strengthening exercise by using spirometer. Okay, or progressive resisted exercise, PRE, by using weight on the xiphoid sternal area. Okay, so in spirometers, basically inspiratory holding technique or sustained maximal inspiration technique is used. Okay, then the proper secretion clearance technique is used. Secretion clearance technique. Okay, in secretion clearance technique, basically autogenic drainage, then ACVT, active cycle of breathing technique is used. Then other technique like modified postural drainage position, and force expiratory technique, that is coughing and hopping is used. Basically the coughing and hopping techniques are assistive technique. Okay, assistive hopping and coughing technique. So before giving this respiratory care, the therapist has to properly examine the patient and see any other associated injury to the chest wall or to the limb. Okay, then after proper examination, one protocol is set. After that, the care is given. Respiratory care means that is the breathing care, and the second is the secretion clearance technique is used. Okay, then after that, the second technique is ROM exercise or range of motion exercise. Okay, range of exercise means It is basically given to reduce the contracture of the joint or stiffness of the joint. So the flexibility, those different type of stretchings exercise is given to the patient. Stretching exercise. So basically it is called as selective stretching technique. Selective stretching technique. So examples are, so for the quadriplegic patient, what happens? The lower back musculature tightness is required to increase the long sitting stability. So if you stretch aggressively the lower back muscles, then the patient may lose the stability on sitting position. And also in that quadriplegic patient, one is tenodesis graft. It is because of the tightness of the long finger flexure. So the tightness of the long finger flexor does not stretch in case of quadriplegic patient. If you stretch that long finger flexor, then that patient may lose the tenodesis graft. And also the hamstring length is also very much important in sitting position, long sitting position, to carry out the other ADL activity. So at least 100 degree of SLR is required for the patient. So basically selectively all the muscles are understretched and overstretched during the therapy session. So it is called as selective stretching technique. Then the other is the strengthening exercise. In strengthening exercise, basically bilateral symmetrical movement is used. Movement is used to strengthen. Basically the PNF techniques are used. To strengthen the muscles. Then different type of weight cups or resistant band is also used. Resistant band is used to give strengthening to the upper extremity. So these strengthening techniques are also selective strengthening techniques are given to the patient. Selective strengthening technique. So as per the patient requirement, by seeing the patient's ability of doing the activity, the strengthening technique is given. So examples are like for quadriplegic, for wheelchair propulsion, the biceps pectoral is required. Anterior deltoid muscles are required. So and these three muscles are basically strengthened. And for long sitting push-ups in long sitting position, basically latissimus dorsi muscles and the shoulder depressors muscles, other shoulder depressed muscles, interscapular muscles are strengthened. Interscapular muscles are strengthened.